Okay, so here's a scenario I bet a lot of you have either lived through or watched someone go through. Someone gets diagnosed with cancer, they go through surgery, the tumor's out, scans come back clean, blood works normal. The oncologist looks at them and says, great news, you're cured. And then 2 years later, 3 years later, it's back. Lungs, liver, bones, somewhere new. Or maybe the targeted therapy that was working suddenly stops working because the tumor figured out a workaround and now they're out of conventional options. At that point, a lot of people start looking sideways at traditional Chinese medicine. They find a practitioner, get their pulse checked, tongue looked at, and walk out with this dark, bitter bag of herbs to boil. And weirdly, for a lot of people, something shifts. The brutal side effects ease up, appetite comes back, blood counts stabilize. Oncologists have a term for this now: long-term survival with tumor. Naturally, this blows up into one of those exhausting internet arguments. One camp says TCM is pseudoscience, glorified placebo. It can't even survive a randomized controlled trial, so it's not real medicine. The other camp swings just as hard the other way. It's ancient wisdom. It heals what Western medicine can't. Here's what I want to do today. Skip both extremes and actually explain what's going on. TCM isn't magic. It's also not a placebo. The real reason it works, and the real reason it struggles to prove itself in a standard clinical trial, comes down to one thing. Chinese medicine is genuinely built around treating root cause, not symptoms. And its main tool for doing that is a 2,000-year-old formula building system called Jūn Chén Zuǒ Shǐ, ruler, minister, assistant, envoy. By the end of this video, you're going to understand exactly how that system works and why trying to test it with a standard drug trial is a little like trying to weigh a symphony on a bathroom scale. Let's start with a concept that's actually cutting edge in modern oncology right now: the tumor microenvironment. For most of the last century, mainstream medicine treated cancer like a plumbing problem. There's a bad lump, cut it out, burn it, poison it, done. But over 100 years ago, a British doctor named Stephen Paget proposed something that oncology is only now catching up to. He called it the seed and soil theory. Here's the idea. The cancer cell itself is just the seed. And get this, your body is generating mutated, potentially cancerous cells basically every single day, even right now, even if you're perfectly healthy. So why doesn't everyone get cancer? Because most of us have healthy soil. A strong immune system, good circulation, balanced metabolism, that's infertile ground. A rogue cell shows up, gets flagged, gets cleared out, end of story. Now think about what conventional cancer treatment actually does. Surgery cuts down the tree. Chemo and radiation carpet bomb the garden to kill anything growing fast. Targeted therapy is more like a sniper picking off specific weeds. All of these save lives genuinely, urgently. When you need the tumor gone now, nothing beats them. But here's the blind spot. None of these actually fix the soil. If your internal terrain is still chronically inflamed, low oxygen, stuck, immune suppressed, and new seeds are going to sprout again, that's recurrence, that's metastasis. This is where TCM comes at things completely differently. It never really saw a tumor as this isolated enemy object sitting in the body. It saw it as fruit growing out of bad soil, what TCM calls a deep imbalance of yin and yang, depleted vital energy, stagnant blood and phlegm. So instead of just trying to kill the cancer cell to death, TCM oncology spends a lot of energy trying to turn the bad soil back into good soil. Because if you actually change the terrain, the seed can't take root again. That's the whole logic behind long-term remission, TCM style. So naturally, the skeptics jump in here. If changing the soil works so well, why hasn't anyone proven it with a proper randomized controlled trial? Good question. And the honest answer isn't that TCM is scared of being tested. It's that RCTs were built to evaluate a standardized, mass-produced product, and TCM isn't that. It's hyper-personalized, constantly shifting care. Think about what an RCT actually needs to work. One isolated variable. If a drug company is testing a new lung cancer drug, they find 1,000 patients who all share the exact same genetic mutation, give half the drug, half a placebo, measure the tumor. Clean, controlled, repeatable. TCM runs on a completely different principle. Same disease, different treatments, and weirdly also different diseases, same treatment. Let me show you what I mean. Picture 3 patients. All 3, according to Western medicine, have the exact same diagnosis. Stage 3 lung adenocarcinoma. Patient A is thin, has dry mouth, night sweats, exhausted all the time. A TCM doctor calls this qi and yin deficiency. The treatment needs to nourish and rebuild energy. Patient B has a heavy cough, thick yellow phlegm, tightness in the chest. That's phlegm heat blocking the lungs. Completely different treatment, needs to clear heat and break up phlegm. Patient C has a darker complexion, sharp localized pain, a purplish tongue, that's blood stasis, needs herbs that move blood and clear toxins. Same Western diagnosis. 3 different bodies, 3 different formulas. Now imagine you force all 3 of them, plus 1,000 more people just like them, to drink the exact same standardized lung cancer tea for a clinical trial. It's going to fail, not because the medicine doesn't work, but because you just gave one answer to 3 different questions. You broke the entire logic of the system before the trial even started. Here's the analogy I keep coming back to. An RCT is basically quality control for a clothing factory. Small, medium, large, consistent, repeatable, off the rack. TCM is a master tailor. He's not making S/M/L. He's measuring you, your posture, your stress levels, your digestion, your temperature today, and cutting a garment that fits nobody else on earth. Judging a bespoke tailor by factory metrics isn't unfair to the tailor exactly. It's just measuring the wrong thing. It's a category error, not a failure. Let's make this concrete with something that actually happens in integrative oncology wards all the time. Chemo is a blunt instrument. It kills cancer cells, sure, but it also causes 2 brutal side effects: violent, uncontrollable nausea and bone marrow suppression, your white blood cell count crashing, leaving you basically defenseless against infection. There's a real case. A 55-year-old woman with stomach cancer, we'll call her Mrs. Wang. After her 3rd round of chemo, her white blood cell count crashed to 1.8. Normal range is 4 to 10. She's bedridden, shaking, 1 infection away from a real crisis. On top of that, nothing was stopping the nausea, not even the anti-nausea injections. She's losing weight fast. When the Integrative TCM team stepped in, they didn't just reach for generic anti-cancer herbs. They diagnosed the actual pattern. The chemo had wrecked her spleen and stomach function, causing that rebellious upward surging nausea, and it had hammered her bone marrow's ability to regenerate, causing deep energy and blood deficiency. So they built her a custom formula, combining 2 classical bases. And I want to walk you through it because this is the ruler, minister, assistant, envoy system in action. The ruler herbs, the main commanders. Astragalus at a heavy dose to rebuild spleen and lung energy and directly stimulate bone marrow to start producing white blood cells again. And inula flower, aimed specifically at the stomach to force that rebellious upward energy back down and stop the vomiting at the root. The minister herbs, the backup. Hematite, a heavy mineral herb, anchoring the stomach and reinforcing the inula flower against severe retching. An angelica root, paired with the astragalus to speed up bone marrow recovery. The assistant herbs, this is the clever part. Processed pinelia and fresh ginger, neutralizing leftover chemical toxicity and calming nausea. Plus 2 gentler herbs, dangshan and baizhu, protecting the digestive tract so her body could actually absorb all these heavier medicines without getting overwhelmed. And the Envoy herb honey-fried licorice. Its job is basically diplomacy. It harmonizes all these strong, sometimes conflicting herbs and steers the whole formula straight toward the spleen, stomach, and bone marrow using the same channel targeting logic we broke down in our bio-internet episode. Within 24 hours, Mrs. Wang's nausea eased enough that she could keep down warm rice porridge. 5 days in, her white blood cell count climbed back from 1.8 to 4.2, safely back in range. She skipped the bone pain that usually comes with synthetic growth factor injections, and her next chemo round happened right on schedule. Notice what's actually happening here. A Western emergency drug usually hits one receptor, one pathway. This formula was simultaneously stopping vomiting, kickstarting bone marrow, protecting the stomach lining, and clearing residual toxins all at once, all in one bowl of tea. That's not one weapon. That's a coordinated operation. So let's zoom out and actually name the system we just watched in action, Jūn Chén Zuǒ Shǐ. A lot of people picture Chinese herbal medicine as just tossing 10 random roots in a pot and hoping for the best. It is the opposite of that. A well-built formula is engineered with the precision of a military operation, or honestly, an orchestra where every instrument has a specific job and none of them are optional. 4 roles. The ruler, your main vanguard. Highest dose directly targeting the root cause, whether that's shrinking a tumor or rebuilding collapsed vital energy. The minister, the force multiplier, backs up the ruler or works on the surrounding terrain. Sometimes that means breaking down the dense tissue around a tumor with blood-moving herbs, just so the ruler herb can actually get in there. The assistant touch are honestly the most clever layer. It does 3 jobs. It can tone down the harshness or toxicity of the stronger herbs. It handles secondary symptoms. And sometimes it does something almost paradoxical, or adding a small warming herb into a mostly cooling formula, purely so the body doesn't reject the whole thing. That's called reverse assistance. And the Envoy, think of it as GPS. It steers the formula towards specific organs or channels, one herb pulling the medicine's action up toward the lungs, another driving it down toward the lower body. And if that sounds familiar, it should. Remember our episode on the body's biointernet? We talked about how TCM maps the body through channels, these invisible communication highways linking organs, tissues, and systems that don't show up on any anatomy chart but clinically behave like they're real. This is where that map actually gets used. It's called channel tropism, the idea that specific herbs, just like specific acupuncture points, have a natural affinity for specific channels. An herb goes to the lung channel. A point sits on the stomach channel. Needle that point or take that herb, and the effect shows up exactly where it's supposed to, not scattered everywhere at once. That's actually the deeper thread connecting acupuncture and herbal medicine. Two completely different tools, a needle versus a root, but both are dialing into the exact same channel map to deliver a precise effect to a precise address in the body. Channel tropism is honestly a big enough topic that it deserves its own full episode. How it was mapped out, how modern research is trying to validate it, all of it. That's coming soon, so stay tuned. For now, just file this away. The Envoy herb isn't just along for the ride, it's the delivery system. Here's the thing that actually stuns a lot of modern researchers when they study this using network pharmacology. This is exactly the direction oncology is trying to move in right now. We're already seeing the field shift away from single magic bullet drugs toward combination therapy, stacking checkpoint inhibitors with anti-angiogenic drugs with low-dose chemo. In other words, what modern medicine is slowly rediscovering in the 21st century is something Chinese medicine built out 2,000 years ago. Complex systems don't respond well to single target fixes. They need coordinated multi-target intervention. So where does all this actually land? Cancer usually isn't just a local lump. It's a systemic problem that happens to show up in one spot. When you need to urgently get rid of a life-threatening mass, Western medicine's precision, surgery, radiation, targeted therapy is genuinely unmatched. That's your scalpel. When you need to prevent recurrence, rebuild a wrecked immune system, manage the toxic side effects of treatment, and actually shift the tumor's environment long-term. That's where TCM's hyper-personalized systems-level approach earns its place. That's your gardener. We don't need to throw out Western oncology and go all in on herbs. And we shouldn't dismiss thousands of years of systemic medicine just because it refuses to fit neatly into a single variable trial box. Those are two different tools solving two different problems, and honestly, the future probably isn't East versus West. It's more like Western medicine kills the intruder, Eastern medicine repairs the ground it was standing on. If you or someone you know has ever combined conventional treatment with something like this, I'd genuinely like to hear about it. Drop it in the comments. It might mean a lot to someone else reading through this who's in the middle of their own fight right now. If this was useful, hit like, subscribe, and turn on notifications so you don't miss the next one, including the upcoming deep dive on channel tropism. Thanks for watching and take care of your soil.